According to the American Cancer Society, colon cancer is the third most common cancer among men and women in the U.S., but there are many myths out there about who gets it and what causes it. So in honor of Colon Cancer Awareness Month, Dr. Brent Wallis from People's Health is here to dispel some of those myths. Good morning.
Good morning.
And so we're going to do the little true-false test and see how many I get right. But let's start with colon cancer is common, but is it true that it's easy to detect? So I'm going to say true.
Very, very easy to detect. The most important thing, though, is that we find it early because it's also, it's very treatable.
So get your colonoscopies. All right, so is it preventable? I would say false, maybe, because you can't really prevent it.
It actually is preventable.
See?
That's why the screening is so important. So colon cancer often starts with a polyp, and polyps are non-cancerous but can convert into cancer. So if you find them early, then you can actually prevent the disease.
Okay, so colon cancer only occurs in people older than 50. I'm going to say false.
That's absolutely true.
Okay.
So the reason why it's important to get screened at age 50 is because that's the most common time to get colon cancer is after age 50. Certain groups, though, in particular African Americans, people of Eastern European descent, and then anyone with a family history of colon cancer is at higher risk. So you may need to get screened earlier.
That would be me.
Definitely.
Family history of that. All right, so there are always symptoms associated with colon cancer. I would say false.
That's true. It is false.
Yes, okay.
And the most common symptom actually is no symptoms at all. If you do have any, if the disease is progressing a little bit, it's typically a change in bowel habits. Sometimes if you see blood in your stool, that's a sign that you need to go get checked by your doctor. It's not always colon cancer, but it could be, so you need to get checked.
All right, so a poor diet increases your risk of colon cancer. I would say that is true.
Right. A poor diet is always bad for you, but in particular, red meat has been linked to a higher incidence of cancer, and high fiber diets have actually been linked to a lower risk of cancer, so it's very important to eat fruits and vegetables.
A polyp means cancer. I definitely would say false with that.
That's correct, because most polyps are not cancerous, but they could be a sign of later cancer, so they're important to be detected and removed.
Screenings are only necessary if you have symptoms. Now that's really easy. False.
That's right.
Because you got to do it anyway.
Screenings are screenings, and so what we use them for is to detect disease that doesn't have symptoms.
Right. So are a lot of people surprised to find like these true, false questions and answers? I mean, when they come to you, do they say, well, I don't have colon cancer in my family, I don't need to get screened? And we hear it over and over again. Get your colonoscopy, what is every 5 years or so?
Every 10 years.
Okay.
I think a lot of people are scared of the test, and the test is really not as bad as you would think, but because of that, they don't necessarily want to get checked out. So there are a lot of myths going around. What I tell people is if you're terrified of a colonoscopy, there are other tests you can get. There are stool tests that are less invasive. So it's important to talk to your doctor about what your options are.
If you have a family history or something, should you go sooner than 10 years? Or?
Yeah, typically, you know, we say you should start screening as soon as the age of the family member that developed cancer, typically 40 or 45.
All right, Dr. Brent Wallis, thank you so much.
Thank you.